When I found out I was going to be a parent, I immediately felt a lot of anxiety and worry. So I went on to BetterHelp to try to look for a therapist to help me with that.
My relationship with my family and with my boyfriend and with myself were suffering. I really needed help.
I was ruminating a lot. Really getting those thoughts out to a therapist and getting feedback was just life-changing.
Discover what BetterHelp Online Therapy can do for you. Visit BetterHelp.com today.
Welcome to Unbiased Science,
where we bring scientific method to the madness.
We're your hosts, Dr. Jess Sarah
and Dr. Sarah Scheinman.
And this week, we are talking about sleep. And maybe more specifically, we're going to talk about the use of melatonin supplements for sleep. And we have a very special guest who Sarah will introduce in just one moment. But before we get into it, a little bit of a public health update that last week, the FDA released findings from the largest infant formula study of its kind that was assessing for the safety of infant formula. So super briefly, and we've done a ton of coverage on this. If you check out our social media page, we have a bunch of posts on this, but they tested 312 samples of baby formula across 16 brands. The study was initiated in 2023 under the previous FDA administration, and follow through took 2 years to build the sample size and complete rigorous lab analyses. Before you ask, no, brand names were not disclosed because the goal was to characterize the U.S. formula supply overall, not to single out any specific brands. They did also test human milk samples for comparison, but those came from a single milk bank, so not nationally representative or generalizable. But the key takeaway is that infant formula is overwhelmingly safe. The data are wonderful, really affirming what we've been saying, what we've known for years, that baby formula is safe. So if you feed your baby infant formula, you do not need to be concerned. Briefly, they tested for things like different contaminants, so things like heavy metals. They tested for PFAS or forever chemicals, and also for pesticides. It was something like 99% of samples had no detectable pesticides at all, including 0 detections for glyphosate. When you're looking at things like PFAS, we're talking parts per trillion. So like a drop in 20 Olympic size, or I think it's a drop in 8 Olympic size pools, actually. I think that's the correct math. And we're talking parts per billion for heavy metals. And a reminder, and the last thing I'll say, is that no one is adding heavy metals, for example, to baby formula or to anything. It's that when things grow in the earth, the heavy metals are present in the environment, in the earth, in water, in the air, all these things just naturally occurring. That was not right to say. Heavy metals do not occur in the air, but I'm saying that they occur naturally in the earth. So when materials or ingredients are sourced from the earth, we have to expect that there'll be some level. But it's so small that there is absolutely no clinical effect. And the rates, the detections were far below any risk thresholds, both in the US and by European standards. All right, that was long-winded. Sarah, please introduce today's amazing guest.
All right, we are so excited to introduce Dr. Beth Malow, who is a professor of neurology and pediatrics at Vanderbilt University Medical Center. She is also a neurology sleep specialist, a science communicator, a TEDx speaker, and co-author of 2 books, the first entitled Solving Sleep in Children with Autism Spectrum Disorders, A Guide for Frazzled Families, and the second entitled Beyond the Politics of Contempt. Her work is also informed by her moderating workshops for an organization called Braver Angels, which is a nonprofit that is focused on bridging political divides. Beth, we are so excited to have you on the show. Welcome.
Thank you so much. I'm so excited to be here. I've been a fan of Unbiased Science for so long.
We love to hear it.
It's a love fest over here. Beth, I know already what Sarah's first question is going to be. Sarah, would you like to ask the question?
Yes, absolutely. So we are here today to talk about melatonin. So you all know how I love to kick things off with any scientific discussion with a definition. So Beth, would you mind just telling us what is melatonin and how does it work?
Great question. So melatonin, it's something we have in our bodies, and I'll explain that in a moment. It's also something you can buy at the supermarket or your favorite drugstore or get online. And that's where it gets confusing to a lot of people. The melatonin that we make in our bodies is released from the brain from a little gland called the pineal gland when it gets dark outside. When it gets dark, that's the signal that our brain needs to release the melatonin. And the reason why is because melatonin is a brain chemical, a hormone, whatever you prefer to call it, that promotes sleep. So when it's dark outside, we know it's time to start getting ready for sleep. And that's where the melatonin that we make in our own bodies kicks in.
So Beth, am I correct in saying that like melatonin is associated with the regulation of our circadian rhythms or our internal biological clocks?
Yes, melatonin actually does a lot of things, some of which are even unrelated to sleep. Like some have connected it with it being an anti-inflammatory agent. When you think about sleep, there's the helping you fall asleep effect, which some people will call sedative effect, promoting sleep. We also use it as a circadian rhythm promoter, and that helps us align our bodies with the outside world. Think jet lag. That's why people will use melatonin supplements to get over jet lag, because it helps us align with the outside world.
So you mentioned, and we will talk about this, people do take melatonin supplements. I hear it often in the context of falling asleep. What about staying asleep? Does melatonin have any role in that? Because I know some people will wake up in the middle of the night. I don't know. Is that another potential impact of taking melatonin?
Most melatonin products are for falling asleep.
Falling asleep. Okay.
However, there are some melatonin products that help us stay asleep. And these are called time release or prolonged release. They have that coating around them that allows for the melatonin to be released overnight. And that really is helpful for staying asleep. It's a challenge because not all kids, especially kids with disabilities, I work in autism, as you heard a lot. Mm-hmm. A lot of kids with disabilities can't always swallow pills. So that's one of the limitations. But yes, there are preparations for both falling asleep and staying asleep.
That's interesting. I've seen also, aren't there melatonin gummies? Maybe that's, for those who can't swallow pills. So, okay, I guess my big question is going to be, I see this heavily marketed. I see it all over the pharmacy counter, and these are over the counter. I don't know if there is also a prescription only. Maybe we could talk about that. But what are your thoughts as a neurologist? Like, is this a good thing, or because then there's also a lot of headlines about how it's potentially harmful. Like, what's the big picture? And then maybe we could drill down to some of the specifics.
The big picture is that melatonin is safe. The challenge is that melatonin is unregulated. Mm-hmm. And what that means is you don't know what you're getting. It could be mixed with CBD. It could be mixed with Benadryl. It could be mixed with chocolate, which doesn't make a whole lot of sense because we know as much as I love chocolate, I don't eat it before bed because it's very stimulating and alerting. It has caffeine.
Right.
It could be that it's pure melatonin. It's only melatonin, but the bioavailability, which means how much we're getting, varies not only from brand to brand, but even within brands, the different lot number can vary. And it's because of all of these issues that melatonin has gotten a bad rap and people are concerned about it. And it kind of makes sense. But what I worry about is throwing the baby out with the bathwater. In multiple studies, melatonin has probably been studied more than any other medicine for sleep or supplement for sleep. And in many studies, it works. In fact, it really works well with very few side effects in certain populations like autism and ADHD. And almost 80% or up to 80% of kids with autism can have sleep problems. So it's a game changer if you can help those kids sleep, because then they have fewer meltdowns, they have less aggression, they can stay in school. The parents aren't waking up at all hours of the night. So the melatonin is a huge game changer. And I hate for it to be thrown out the window or whatever because people are concerned. I would love to see melatonin as a prescription drug. I really would. The Food and Drug Administration has not approved it in that way. I hope it does. In the meantime, the Food and Drug Administration does have a mechanism where companies that make nutritional supplements, dietary supplements like melatonin, can get a designation, can get a label. It's called the USP designation, US Pharmacopoeia. They can submit their drug safety file and show that they've got a pure product that just has melatonin, that the bioavailability is constant from lot to lot. And then they can put that on their bottle. And there are a couple of brands. I don't have any conflict of interest, but one is Natural and one is Nature Made. And they have sought out and received that USP designation. And that's the best thing we have right now. I would love to see melatonin as a prescription drug. I think it would solve all of these issues if it were prescribed. And in the meantime, we're turning to things like Ambien and other very strong medications with a lot of side effects because we don't have a melatonin prescription drug.
I once took an Ambien and it's like I traveled through space and time. I woke up like, where am I? What year is it? So I can't imagine. I don't even know if it's very strong. And I don't know if there's a dose for children. I have no clue. But
no, and people, as you say, I mean, you can have amnesia with it. So you take the Ambien and people have been shown to unlock their computers and send emails that they
That's dangerous.
It's really scary. That was the one that got me. I mean, there's also risks with driving a car and sleepwalking, but that email thing, oh my gosh, that hit me as I'm never taking an Ambien, right?
So Beth, as long as we're talking about side effects, are there any side effects associated with melatonin?
There are some mild effects. We did a study of 107 kids at Vanderbilt several years ago, and we found one child had bedwetting, and another had headaches, and another had grogginess. So there are some mild side effects. There's nothing super scary, and if you stop the melatonin, they go away. In general, what we found is that melatonin helps kids sleep deeper, which is why you might see the bedwetting, right? Because they're in a deeper stage of sleep. In general, the side effects have been really mild. Now, you have to be careful about overdose, especially with those gummies. One of the things that I tell parents is you still need to treat the melatonin like a drug, even if it seems like it's a supplement and it's a gummy and whatever, because kids can get into it and overdose, and that could be serious. But in general, if you just take it as recommended, it has very few side effects, very few drug interactions, a few interactions. It acts on the liver. But I also recommend along those lines that melatonin be taken with the knowledge of your child's pediatrician, or if you're an adult, with the knowledge of your primary care doctor. or primary care provider, because sometimes there are some interactions that they need to be aware of.
And at what age, like, is there a certain age when you can start taking melatonin? Or can you be too young for melatonin? Well, let's start there.
Yeah.
If you could.
I mean, it's recommended by different societies and organizations that you really don't give it before age 2. I have on occasion when I've had a child who was really struggling, because I think it's pretty benign. And I would use one of those brands I mentioned with the USP designation. But in general, 2 and above has been considered reasonable. If it's a child who's neurodiverse with autism, ADHD, I think using it at a younger age makes sense, because then it's kind of a balancing act between the benefits and the risks. And there's a lot of benefits in a child who's struggling with sleep.
Mm-hmm. So Beth, I know one of your many accolades is that you work, you do a lot of work with you're a sleep specialist. So I was wondering, maybe could you comment a little bit, like just in general, of the importance of sleep, especially for these neurodivergent children? We were talking about how melatonin is often used for them.
Yes, I believe that sleep is important for anyone, right? We all know how we feel when we haven't slept. We're more apt to send that snarky email or text that we'll regret the next day when we're more well rested. These kids who are neurodivergent, for example, autism spectrum, they are really struggling even more. They are struggling with how they feel during the day, how they regulate their emotions. They have meltdowns. They don't progress in therapy as quickly as they could because they're not just sleepy, but more overactive. Their parents are stressed from the lack of sleep. They're not doing well in school. The parents are being told that their kids are having behavior problems and all of this. So if we can get these kids sleeping better, we've not only shown in our research, but anecdotally, when I see these kids in clinic, it's the parents are like, sleep has been a game changer for my child. And I always start with the simple behavioral approaches, having a really solid bedtime routine, making sure that you interact with your child in such a way that promotes sleep, making sure that they're not getting exposed to too much caffeine, that they're getting enough exercise, that they're off their phones. All that basic common sense advice does actually work in autism and kids with other disabilities or who are neurodiverse. The challenge is that sometimes kids need more. They need something to jumpstart, for example, the bedtime routine, or the parents are so overwhelmed that they need a little bit of extra to try to jumpstart the bedtime routine. And that's where melatonin can come in.
So you just answered actually the question that I was about to ask, which is, are there things that parents could try before reaching for the melatonin?
Yes.
And it sounds like, yes, we should exhaust try these other things, strategies first. And if they're not working, then to consider.
Yes. And I would add one important thing, which is if I start melatonin to jumpstart a routine, my goal is to then stop the melatonin once the parent is putting into practice all of these wonderful things like the bedtime routine, like exercise during the day, like getting the child off the cell phones, like having them learn how to fall asleep and stay asleep on their own. It's a temporary measure to help the parent and the child learn those habits, and then hopefully you won't have to continue it.
So I'm glad that you said that, because I know there's some concern about long-term use. Parents are concerned, is this going to interact with hormones or puberty or development in any other way? So can you comment on that? Like, do we know
Yes.
if long-term? Okay, thank you.
So And I have to say, I do have a conflict of interest here. I'm always very upfront about that. I mentioned the study that I was involved in because it's really the pivotal one. It was done with the company Neuron Pharmaceuticals. They're an Israeli company, and we followed kids on melatonin. Most of them had autism through puberty. Several of them were already actively going through puberty. Some were about to start. And we did not see a quickening or slowing down of puberty with melatonin. Now, you might say, where did this come from, this melatonin puberty concern? What happens is when we go through puberty, our natural melatonin levels plummet, they fall. And people believe that's a signaler. When the melatonin levels fall, puberty starts. Well, the concern would be if you're giving kids melatonin, you're going to block puberty from starting because you're keeping their melatonin levels high. But that, as we know, it's more complicated than that. And it's not that the melatonin levels are necessarily falling and puberty starts. There's a whole cascade of different things that are happening in our brains and bodies. And the falling of the melatonin may just simply be a side product of all of that. So in our study, we specifically wanted to single out what happened to pubertal developments with melatonin in this trial. And I was first author on the paper. And what we found was that puberty did not change, whether you were on melatonin or placebo. And then in the long-term use of melatonin up to 2 years, when we compared it with natural progression of melatonin, there was no change. So melatonin did not appear to affect puberty in any way. And that was something that a lot of parents have asked me about. It's probably the number one question. And rather than telling them, no, you don't have to worry about it, instead, what I did in a series of blogs is say to the parents, here's the evidence. This is what happened. And you judge for yourself whether melatonin is right for your child. Here's the data. I want you to look at it. I want you to make up your own mind. So that was a really nice study to be able to add to our toolkit for parents.
We'll have to link to that. It's published. That would be
Yes.
That would be fantastic.
Yes.
Beth, are there any people who, like, right off the bat are not candidates for taking melatonin, or for whom it would be definitely, not recommended, not safe? Are there any disqualifying characteristics?
There are a few medications that interact with melatonin, and honestly, I would need to look those up to be sure. I would just say there are a few medications that interact with melatonin. So talking to your child's pediatrician or primary care provider is really, really important. Otherwise, I just tend to avoid melatonin in kids I know have a history of really severe headaches, or who I'm worried about overdosing. I'm worried about the child. That's why I try to stray away from the gummies when I can, because they're so easy to take too much of. Mm-hmm. But otherwise, I really have not seen concern with taking melatonin.
Beth, is there any risk of, when we're talking about like long-term use, is there any risk of like development of like of a dependency on melatonin for sleep? I mean, in children, but also for adults. I know it's a concern. We mentioned Ambien. Development of dependency with those types of heavier medications is a concern. Is that the case with melatonin as well?
We get the question about dependency a lot from parents. It's very common. What we found, when you stop taking melatonin in one of these trials, we don't see evidence of dependency. We don't see the child reverting back in some way we don't see withdrawal effects from the melatonin. Yeah, when we do a long-term study, we don't see withdrawal effects from the melatonin. They may have trouble with sleeping again because they need the melatonin to sleep, but we're not seeing that we've gotten them into a state that when we stop it, they're going to be worse off.
So I'm glad, Sarah, that you flagged adults, because we've been talking primarily about children, right, in this conversation, Beth. Are there any differences that we should be mindful of, like the way we take or how often we take or when we take melatonin for adults versus children? Or is it pretty much the same, but I would imagine the dosing is probably different?
Yeah, the dosing for kids, I always like to start with 1 milligram and work my way up. For adults, I actually oftentimes start there as well, unless it's some huge, big, muscular guy, I might start with 3. But in general, I tend to start with the lowest dose in anyone, whether it be adult or child, because you just want to make sure that you're not over medicating, and if you need less. I will say the one thing your readers maybe have heard about is there was a study in adults of melatonin that was associated with heart failure. Have you heard of this?
I have not.
Yeah,
No.
Yeah. And what was interesting though is it was an abstract, right?
Sure.
So it wasn't peer reviewed, and it's important for people to know that in these studies there can be so many different variables.
Right.
Yeah.
And just one thing on that note, I mean, I would be very curious without, having not read the paper or the abstract, is that I would imagine sleep might have an impact on cardiac. Again, this is not my area, but it would be that I would think is an important confounder, that they would need to control for in a study.
Yeah, and also the fact that maybe people were being put on melatonin because they were like, oh, this is going to be more minor, and we don't want to give them something stronger for sleep like Ambien because we're worried about them. So, but I just wanted you to be aware of that. I think it may be a bit too much to go into on this.
Yeah. Okay. Are there any other commonly asked questions or concerns that you think we'd be remiss if we don't tackle on the episode?
I think the one important area is parent autonomy. I love working with parents of kids with neurodiverse children because parents of kids who are neurodiverse, because they are the most amazing parents. They really put their energy, their heart and souls into having their kids do well. And it's really important to me. I value the work Unbiased Science is doing because you care so much about making sure that parents have choices, they have the knowledge, and then they can decide for themselves what's right for their child. And that's what's informed my work in publishing a book on sleep and autism, in the research I've done, the approaches we take in our work, our behavioral approaches, is giving parents choices and giving them options and making it personalized to the child and the family. I think that's a really important piece, because if a parent feels like they are getting that attention and they can decide for themselves whether melatonin is right for their child or they want to work with the behavioral strategies a little bit longer, you're going to have a much better outcome than if you simply tell a parent what to do or you write a prescription.
I love that so much. And I do want to say, I admire your approach, to everything. I admire the way that you communicate. And I am a huge fan of the Brave Angels. I just want to put that out there. I've collaborated with the organization a couple of times. And I think it's just an incredible incredible effort to depolarize, the United States. And I think what you just said is really important. I think for some issues, when there's real, medical necessity, that's a different story, right? Where you absolutely, you should listen to the guidance from your physician, your child's pediatrician, whoever it may be. But for something like this, it sounds like maybe there are a couple of different approaches and that could be weighed by parents, and we certainly don't want to discredit or to take away parents' decision making. So I think that's a really nice balanced approach.
And I have one more thing to say. I'm sorry.
Yeah. No.
I think the other piece that we want to make sure we get in somewhere is that we want to look for medical causes. We want to look for sleep apnea, seizures. We want to look for eczema, reflux, anything, GI reflux, anything that could be interfering with a child's sleep. It may be the medicines they're taking for depression. Right. Or anxiety or ADHD, all of that can affect sleep. And we don't want to overlook that and reach for the melatonin when that might actually be the root cause. So I spend a lot of time focusing on what is going on with the child, and then can we put some simple behavioral strategies into place? And only then do I think about medications.
Oh, I love that. I think that's so root cause. That's the
right.
term du jour these days, right? And we definitely don't want to just paper over something. If there is something that's causing or driving the sleep disturbance or difficulty sleeping, I'm so glad that you said that, Beth. Thank you. Dr. Beth Malow, thank you so much for joining Unbiased Science. Where can folks follow along your incredible work?
Oh, thank you. There's several things. One is that I do have a Substack that has a variety of issues in it. It's togethernow.substack.com, Together Across Differences, and we do touch on these areas. I would also say I've got my own website, bethswisdom.com, BETHS wisdom, one word.com. And then I also have a variety of papers, and you can look me up on the internet or do an AI search, and you'll come up with videos, you'll come up with podcasts, you'll come up with papers that I've written on anything from melatonin safety to behavioral interventions for children with autism and other related conditions.
Thank you. Thank you so much for your work. Sarah, do you want to take us home?
All right. Thank you so much for joining us, Beth. And thank you all for tuning in. We hope you learned a thing or two. I certainly did. Please join us next week on your trusted source for no nonsense, just science.
If you like the show, please take a moment to rate, review, and subscribe. It really does help the show to grow. Thank you for listening.